So good afternoon, NCM 102 students. So for this week, we will be learning more on how we design, implement, evaluate, and how do we document a health education plan. So of course, in designing our health education plan, we all know that this is very relevant in terms of designing a particular strategy, a particular instructional design strategy, a method for us to be able to implement a very effective way of allowing our students to grasp or learn more effectively and meet our objectives. So this afternoon or this morning, we will tend to or we will try to review again back the different characteristics of the specific age groups, which we have tackled weeks before in this course. And then we will be discussing more on how do we implement, how we evaluate, and how we document our health education programs or plans for our learners. Now, so first up, we have the infancy, first 12 months of life and toddlerhood, 1 to 2 years of age. So again, at this point, exploration of self and the environment becomes paramount and stimulates further physical development. So patient education and must focus on teaching the parents, no, of the infant, of a very young child, and the importance of stimulation, nutrition, the practice of safety measures to prevent illness and injury, and health promotion. So we are more of educating the mother, the father, the parent, the guardian. No, so we are more focused on examples, or our teachings must be more of making home environment safer, preventing secondhand smoke exposure. So anyone from the relatives or somebody at home who is smoking, there should be a good advice or education towards the relatives or family members who do smoke, to do away with the habit, because there would be a child who will be affected by that. Promoting infant oral health, no, so actually I experienced this when my pediatrician told me that my child or my baby, she was only 1 year and 8 months. She must be able to go not to a dentist for her checkup. So as early at that point, no, there must be already a inspection, assessment, checkup of the oral cavity, the teeth or the tooth of the child must be monitored already. Monitoring sleep-related infant death. So this is what we call the SIDS, no? So there are child or infants who unfortunately die during sleep because of the positioning, no? So there must be a clear instruction of, as a nurse, how do we instruct to avoid these instances, no, to happen, because we have to really educate them. Okay, so how do we monitor the child or the baby during sleep? So it's better to be bare, no blanket, no pillows, so that nothing will impede the airway of the baby. And if you put the baby um, prone position, it's better that you put the baby what it's better to place a baby in a supine position so that you could monitor the breathing of the baby, no, and do not leave the baby alone as well. So for short-term learning, how do we design our health education plan for this type of or specific age group? We have to read simple stories from books with lots of pictures, because they really they really enjoy listening to our voice, the sound of our voice. So you have to um, be very creative in creating your different sounds if you talk to them, because they really enjoy listening to the sound of our voice. Use dolls and puppets to act out feelings and behaviors, no, so you can imagine, if you have a doll or a puppet, then you have to act out those items, no, so that they could relate, no, to those items, no. So use simple audio tapes, music and videotapes, and with cartoon characters, so they would tend to listen and remember, then they would tend to imitate the sound. Role play to bring the child's imagination closer to reality. Give simple, concrete, non-threatening explanation to accompany visual and tactile experiences. Perform procedures on a teddy bear or doll first to help the child anticipate what an experience will be like. So for example, I have a tool, I have a stethoscope that is for kids or children, kanang toy stethoscope. So I tend to use that. I have a teddy bear with me, and I tend to listen to the breath sounds or the heartbeat. No, so my child would tend to imitate and would anticipate. Oh, so that's how you check the heartbeat. No, so they would also imitate your actions. Allow the child something to do, squeeze your hand, hold a band-aid, sing a song, cry if it hurts, to channel his or her response to an unpleasant experience. Again, keep teaching sessions brief because, again, there would be only a very short learning span for this type of age group. Cluster teaching sessions together or close together so that children can remember what they learned from one instructional encounter to another. Individualize the pace of teaching according to the children's response and level of attention. So do not compare the level of progress of each of the children because everybody is unique. Everybody has its own timing. So other kids may be able to talk and understand slow. Others may have a very fast learners. So be patient if you will be the teacher, if you'll be the nurse educator. For long-term learning, it's very important that we perform rituals or actions, actual demonstrations for them to imitate, no, repetitive actions like you do your hand hygiene, you do your hand washing. So every now and then, if you keep on doing those kind of actions, they tend to remember and recall or that particular action. So meaning you wash your hands before you eat, after you eat, so they tend to remember that and imitate that. Reinforce an opportunity for children to achieve permanence of learning through practice. So that's what we had mentioned earlier. Employ the teaching method of gaming and modeling as a means by which children can learn about the world and test their ideas over time. So you as a mother, a parent, or a nurse, you will be having these activities like games and modeling so that the child will tend to imitate you and remember your actions. No, encourage parents to act as a role models because their values and beliefs serves to reinforce healthy behavior and significantly influence the child's developments, no, and also their characters and attitudes. So for the preschoolers, so again, for preschool learners, we know that we are very curious, can think intuitively, and pose questions about almost anything. They want to know the reasons, the cause, the purpose of everything. No, so they are really fond of asking questions. So what will be our strategy for this type of learner? So again, we have to keep our teaching session short. Now at 15 minutes max, no, in our schedule, and sequentially schedule at close intervals so that information is not forgotten. So if you schedule 15 minutes now and then you have a short break and then close intervals because they tend to remember, no, not very lengthy intervals so that they won't forget the information. Then again, repeat your teaching sessions to them. No, repeat again the things that you want or you're teaching your child. No, so again, at this point, preschoolers, they haven't developed yet their language at its fullest. So there's still a limitation in terms of talking. So you have to stimulate their imagination through visual stimuli, no, expressing ideas through visual representation so that they will appreciate that information. No? So relate information needs to activities and experiences familiar to the child. For example, ask the child to blow a candle on a cake to practice deep breathing, no? So that they could relate blowing a cake. So how do you deep breathe? So you will give an example like you blow the candle. So then they will tend to correlate blowing of candles to deep breathing. No? So encourage the child to practice in selecting between a limited number of teaching learning options such as dolls or reading a story, which promotes active involvement and helps to establish nurse-client relationship or rapport. Arrange small group session with peers to make teaching less threatening and more fun. Give praise, approval through verbal, non-verbal, and rewards, no, through toys, badges, immediately after following a successful learning experience. So don't forget to appreciate. Very good. You've done a good job. You performed very well. Give them a clap of hands. So both nonverbal and verbal gestures. You also would like to hug them if or kiss your child if they're able to perform a procedure successfully or the learning experience has been a success. For example, my child, no, I have a chart at home and then I tend to point the figures. Then my baby tends to house, go, try to name the items mentioned in the chart. So I then, if they will be able to do it perfectly or even not perfectly, but if they're able to do their best, I do give my child a big hug, and I always say, very good, you did a great job, so that they will be encouraged, no? And then you can also give tangible rewards, no, like toys and so on. I also have a stamp at home, like star. If ever my child performed very well, I put star in the hands. Those stamps that would not cause any allergies in the skin, no? Allow child to manipulate equipment and play with replicas or toys. Allow them to touch, no? Use storybooks to emphasize the humanity of healthcare personnel. So long-term learning, again, enlist the help of parents who can play a vital role in modeling a variety of health habits. Again, at this point, your baby is really watching you as a model, no? So you must be able to do the actions in terms of measures or actions that would promote more in terms of healthy practices, because this is what your child is really looking at, because you are the role model, no, at this point, no, so they're looking at your actions. School age. So for the school age, they are at this point wherein there's a progress already with their physical, cognitive, and psychosocial skills, to the point wherein they begin formal, structured school system. So how do we approach our teaching towards this type of age group? So again, teaching sessions still be limited and would be maximum 30 minutes, okay? And then it is very helpful to use still diagrams, models, pictures, digital media, printed materials, computer, tablet, or smartphone application. But we have to be very cautious as educators in utilizing, again, screens, no, TV, laptops, gadgets. There is limitation as to the use of these gadgets, because that will impede the development later on if you tend to give them more time in doing this applications, no? So be very careful and consult always your pediatrician if you use this one, okay? And then there must be an adult who will be guiding the school age group of children when they watch something on on a gadget. You don't have to leave them using the gadget alone, so you must be there and guide and reinforce the things that they are watching, okay? Use analogs as an effective means of providing information in meaningful terms. So for example, in my diagram here, red is to stop as green is to what. So this is trying to compare two things, no, based on the things that they are alike. So you try to match, no, or a comparison of things based on ways that they are the same, no. That is what we call analogies, no. So puppy is to dog as kitten is to cat. So you can use that activity to them. Use one-to-one teaching sessions as a method to individualize learning relevant to the child's own experience, no? As a means of interpreting the results of nursing intervention specific to the child's own condition. One-to-one teaching session would be very helpful. So if you have group sessions, that would do for socialization, but it is also very beneficial if you also perform one-to-one teaching sessions with the kids, so that you would know you have a focus on looking at their progress, okay? So long-term learning helps school-age children acquire skills that they can use to assume self-care responsibility for carrying out therapeutic treatment regimens on an ongoing basis with minimal assistance. So you may be able to teach them simple tasks like cleaning your wound, no, putting your band-aid so that they would be able to carry out self-care responsibility, or even hygiene, no? Personal hygiene, brushing your teeth, combing the hair. Those is very important. They could perform on their own, no? Assist them in learning to maintain their own well-being and prevent illnesses from occurring. So that's what I mentioned. So adolescent group. So again, going back, adolescent marks the transition from childhood to adulthood. During this prolonged and very change-filled time, many adolescents and their families experience much turmoil. No? So how adolescents think about themselves and the world significantly influences many healthcare issues facing them, from anorexia to obesity. No, let's say for example, your peers would tell you you're so fat. No, so at this time, no, the world means a lot towards you, the outside world, the peer pressure. So if you will be teased because you're fat, you tend to what, become anorexic or bulimic, like you tend to vomit the food that you eat because you want to lose weight, no? So those are the problems commonly encountered during adolescent, or naa ba siya daghan pimples, no? And then the classmates tend to tease, no, the individual. So you tend to have a low self-esteem. So that's again where you enter there. That is where you should enter as a health educator. So you would inspire that person to do what is the right thing rather than doing the opposite way. No? So again, short-term learning for this type group, choose peer group discussion sessions and an effective approach to deal with health topics such as smoking and drug use, safety measures, obesity, teenage sexuality. That's why it's very important to also have that sex education during this time, because at this point, in adolescent stage, you are very curious on things. No, you are very curious on things. So it's better. I learned this from my pastor. No, it's better to prepare than to repair. Meaning, you have to prepare your child to what is the real world rather than to repair them after an incident already. So you have to educate. You have to really talk to the adolescent, to your adolescent child or kid, or in school, no, because there's lots of burst of feelings, emotions, no, peer pressures, so that would really affect their mental health as well. No, so use face-to-face or computer group discussion, role playing, and gaming as method to clarify values and solve problems, which feed into teenagers' need to belong and to be actively involved. Share decision making whenever possible, because control is an important issue for adolescent. No, so how do we decide on matters? No, do we decide on the height of our emotions? Do we consult this one to our parents or to a friend? No, so how do we do our decision making? Sharing, no, sharing decision making whenever possible. Consult someone who could help you out. No, consult someone who is really a good influence in your life, right? Include adolescents in formulating teaching plans related to teaching strategies, expected outcomes, and determining what needs to be learned and how it can be best achieved, to meet the needs of autonomy. Suggest options so that they feel they have a choice about courses of action. So again, we want to let these teenagers or adolescents feel the liberty, the freedom to choose what they want. So you can give options. What do you want to do? Option A, this is what you can do. Option B, if you don't want that, so give them various choices, no? And then let them decide on their own. No? Give rationale for all that is said and done to help adolescents feel a sense of control. So meaning you have to explain to them what would be the reason of this action or decision. Approach them with respect, tact, openness, and flexibility to elicit their attention and encourage their response to teaching learning situation. Respect towards their opinion, no, being open, no, do not be judgmental at this point if you will be the educator. Next is expect negative responses, which are common when their self-image and self-integrity are threatened. So they may what, feel a low self-confidence, no? A negative response, a negative acknowledgement because they felt what? Um, if ever they will be in a position wherein their self-image is threatened, no? So you tend to have an open mind and clearly understand, no? Just have the patience to understand what these adolescent people are going through. Avoid confrontation and acting like an authority figure. So it's better to be what? Very friendly in approaching them, because that is where the time wherein they will really what? Share their true feelings towards you and not hide their feelings. So be someone that they are comfortable in talking to, no, not just an authority figure, no, then try to just discipline them all the time, no. So we have to try to let them open up, and speak up, no, and open things towards you so that they will not shut you down. Okay, so long-term learning, accept adolescents' personal fable and imaginary audience as valid rather than challenging their feelings of uniqueness and invincibility. Now, so we have to acknowledge their feelings, what they're going through, rather than being judgmental towards them. Now, acknowledge that their feelings are very real because denying them their options simply will not work. Now, so you have to acknowledge that what they're going through is just normal, and then this is how we can solve this one. Okay. So young adults. So for young adult, these are what we cohort them as being between 20 to 34 years of age, who belongs to the millennial generation, no? As well as the cohort currently aged 34 to 40, which is known as the Gen X, no? So for the young adults, they commonly face many challenges as they take steps towards controlling their own lives, no? So many of the events they experience are happy and growth promoting, no? Promoting from an emotional and social perspective, but they also can prove disappointing and psychological draining, no? The new experiences and multiple decisions young adults must make regarding choices for career, marriage, parenthood, and higher education can be quite stressful in this stage. That's why we can say that young adulthood is a crucial period for establishment of behaviors that help individuals to lead healthy lives, both physically and emotionally. And this is also a stage wherein we say this is the teachable moment for them, because this is where they take opportunities, advantages to promote their healthy behaviors at this point of their life. So for young adulthoods, the major factors that need to be addressed in this age group, if you want to design your health education program, is more of healthy eating habits. Because actually at this point in your age, you are between 20 to 34, you do not feel any illnesses, diseases at this point, because you're in the height of you being healthy individual, no? So you don't really suffer much of high blood, diabetes, because you're still young, no, at this point. That's why the target for this age group is really more of what? Health promotion, maintaining your health. So that's why eating habits is very vital, because you don't want that diseases will develop eventually. So you want to keep your youth, or your body, your young body, to be healthy, no? So regular exercises, avoid drug abuse, reduce incidence of high blood pressure by eating fatty foods, health promotion and disease prevention measures. So this is the very important teaching education if you want to design a program to this age group. For the middle-aged adults, no, the nurse must be aware of their potential source of stress, no, the high risk factors associated with this stage of life, and concerns typical of midlife crisis, no. So again, at this point, middle-aged adults, no, so maturation, physiological changes will start to to take place. No, skin and muscle tone will start to decrease. Metabolism slows down. That's why you can gain weight if you will not go, or if you will not try to exercise. Body weight tends to increase. That's what I said. Endurance and energy levels lessens. Hormonal changes brings about a variety of symptoms, and hearing and visual acuity starts to diminish. No? So all the physical changes and others affect the middle-aged adults' self-image, ability to learn, and motivation for learning and health promotion, disease prevention, and maintenance of health. So, okay, sorry, let's go back. Okay, so what would be our teaching strategies, no, for this age group, no, for the middle adulthood, no? So if we teach the middle adult um, age group, the nurse or you as a nurse must be aware of their potential sources of stress, the health risk factors associated with this stage of life, and the concerns typical of midlife, no? The midlife crisis. Misconceptions regarding physical changes such as menopause are common. Now, stress may interfere with mid-age adults' ability to learn or maybe a motivational force for learning. So some of the myths, no, or the misconceptions of menopausal at this age, no. So we thought that your body will stop producing hormones after menopause, no, which is false. No, hormones still travels throughout our body all our lives, keeping complex processes in balance as a growth, metabolism, and fertility. And sometimes we also think that hormone replacement therapy is dangerous at this point. Menopausal women need the lowest amount of hormones for the shortest possible time. All women in menopause get hot flashes and night sweats. No, so these are the things that disturbs their focus. No, because they tend to think of the misconceptions that would disturb them. Stress may also interfere at this point, no? So those who have lived healthy and productive lives are often motivated, no, to contact health professionals to ensure maintenance of their health status. So next we have the older adult group. So again, nurses must be aware of the possibility that older patients may delay medical attention, has decreased, so their cognitive functions, their sensory functions has already decreased. No, so chronic illnesses, depression, literacy levels will start to develop at this time. No, so in working with adult learners or older adults, we have to reminisce. Now remember the beneficial approach to use to establish a therapeutic relationships. Therefore, memories can be very powerful at this point. No? So we have to talk about their personal experiences, marriage, children, grandchildren, their job, community involvement. So we have to recall and remember and talk their life experiences. No? So we always have to remember, being a health provider, no, that older people can learn, but their ability and needs would differ at this point compared when they were still young. No, so the process of teaching and learning is much more rewarding and successful for both nurse and the older patient if it is tailored fit. No, the older adults' physical, cognitive, motivational, and social differences. So again, in this table, as you can see, these are the changes, physical changes that an adult or older adults would develop. No, the hearing, no, vision, motor, arthritis, they will develop also. No, so what are the possible solutions that they could do? So implementing a health education plan. So I will be tackling that on the next video so that we will not be very lengthy in this presentation. So we'll have part 2 of the presentation in the next video. Thank you for listening.